Welcome, everyone. I think we'll go ahead and get started for the sake of time. My name is Judy Barton with Healthcare for All Minnesota. Thank you for joining us tonight. Just a couple ground rules. First off, if you have a question, if you could please use the reactions at the bottom of your screen, the Zoom toolbar. There's something that says reaction. It has a little smiley face. If you click on that, there is something that says raise hand, and just click on that button and that'll pop up and let us know that you have a question. Please don't start talking until you have been called on, just for the sake of keeping everything running smoothly. If you have any questions, you can also put them in the chat feature and we will be happy to answer those. With that, I'm going to hand it over to Ann Jones. Ann.
Hi, good evening, everyone. Welcome to our Healthcare for All Minnesota and Physicians for a National Health Program Minnesota quarterly meeting and year-end wrap-up. Thanks to Judy Barton, our Healthcare for All Minnesota Director of Operations, and Jen Crawford, PNHP Minnesota Executive Director, for hosting this meeting this evening. I'm Ann Jones, retired registered nurse and Vice Chair of Healthcare for All Minnesota and activist on this issue. Quick look at our presenters for this evening. Again, welcome. We invite you to turn on your cameras for this meeting. We set it up to be a meeting format. We hope you came wearing your favorite holiday sweater and that you brought your beverage of choice. We have a very full agenda, and that we hope will give you a good sense of what we've accomplished in 2023 and what to look for in 2024, and perhaps where you might want to get a little more involved this next year. We're going to hear from Rose, our Healthcare for All Minnesota board chair. We're going to then meet and hear from Dr. Christy Atkinson, our incoming Physicians for a National Health Program chair, get a treasurer's report and a little snapshot of our year-end fundraising efforts. Hear from Rose again on restructuring to win the Minnesota Health Plan on our committee work, an update on coalition building, our work to bring in organizations, like-minded organizations, to this work, legislative and policy report. I should say Dr. Ken Engelhardt will do our update on coalition building. Don Pilkinen, Dave Garibaldi, and Rose will talk about legislative and policy work. Then we'll hear from Rose again on the national landscape, efforts to protect and expand Medicare, and then an update on the Minnesota Health Plan Legislative Caucus that you will be very interested in hearing about. Then Jen Crawford, Executive Director of PNHP Minnesota, a review of the year from the perspective of our partner, PNHP Minnesota. I will give a thank you to our volunteers and make a couple announcements, and then a calls to action and a wrap up. So let's go ahead and hear from Rose, our chair of our Healthcare for All Minnesota board, also the national coordinator for the labor campaign for single payer.
Thank you, Ann, and good evening, everyone. Thank you all for joining us tonight as we wrap up 2023 and begin the process of preparing for 2024. We in the social justice movement seldom take the time to celebrate our successes, but we absolutely should do that. This is hard work that we're doing. We're fighting against some of the most moneyed, powerful entities in the world. So it's important for us to take a moment to reflect on that fight and recognize moments of triumph when people stole the spotlight from profit. Those triumphs include passage of a number of patient-centered bills that were signed into law this past spring. Bills that include a fully funded comprehensive study of the Minnesota Health Plan compared to our current expensive, fragmented, and dysfunctional system, covering our undocumented friends, family, and neighbors through Minnesota Care, a directive to begin the process of deprivatizing our public health programs. Finally, we'll be getting a concrete review of wasteful administrative costs, and really important financial protections were also passed for Medicaid enrollees and their families. Triumphs also include our visibility within our communities, from pride festivals across the state to Farm Fest to the great Minnesota Get Together, the State Fair. Healthcare for All Minnesota and PNHP were there. We also sponsored numerous educational forums, provided speakers for events across the state, helped with the Minnesota AFL-CIO adoption of a resolution to level the playing field between Medicare Disadvantage plans and traditional Medicare, and secure our place as policy experts as agency staff at the Departments of Human Services, Commerce and Health, as well as the governor's office, as those staff work on the important work that is directed by the legislature on healthcare reform for them to start working on. Yes, there is still much work to be done. We do not yet have the conditions necessary to make the Minnesota Health Plan or Medicare for All our immediate reality, but we have begun to lay the stepping stones on the pathway to achieving our ultimate goal. And none of this could have been done without the incredible volunteer activists of HCA-MN and PNHP, and that includes all of you. I want to give a special shout out of appreciation for our respective board of directors, committee chairs, trainers, and speakers, and especially our incredible staff, Judy Barton, our Director of Operations, and Jen Crawford, PNHP's Executive Director. They always go above and beyond to turn some of the crazy ideas that we come up with into effective tools for winning healthcare justice. So as we wind down 2023, let's take this time to celebrate a truly successful year. Enjoy a little breather as we celebrate family and friends during the upcoming holiday season and prepare for what's to come in 2024, a year in which our very democracy, as we know, is on the ballot. Arundhati Roy, an Indian author and activist, beautifully sums up our ongoing work together when she wrote, "The system will collapse if we refuse to buy what they are selling, their ideas, their version of history, their wars, their weapons, their notion of inevitability. Remember this, we be many and they be few. They need us more than we need them. Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing." I too can hear her breathing. She's reminding us of our common humanity. We must stand firm on our principles and values and mean it when we say healthcare for all, no exceptions. Fight for each other and ourselves as patients, stop the profiteering off of human beings suffering, and demand that our elected officials do the same. Si se puede, everyone. Thank you.
Thank you, Rose. Now, I am excited to introduce you to Dr. Christy Atkinson, the incoming chair of the Board of Physicians for a National Health Program Minnesota chapter. Dr. Atkinson is a family medicine resident at University of Minnesota Medical Center and feeling it from the trenches, and got her start with Students for a National Health Program, medical students working to fix this mess. Go ahead, Christy. And maybe we could.
Thank you, Anne.
Okay.
Always hard to follow up Rose, but very happy to do so. Yeah, so nice to meet you all. My name is Christy. I am in my last year of family medicine residency training here in Minneapolis. I went to medical school up north in Duluth and was involved with the single payer movement pretty early in the medical school. And perhaps you saw in my kind of end of year letter that it was really disheartening to start my training and realize how dysfunctional the medical system is and related to how we pay for our payment system. I was also involved in the Healthcare for All Duluth chapter too up there in the pre-COVID era. So it was really exciting. And so I'm happy to be working with Healthcare for All Minnesota down here. As Anne alluded, I see the issues with our system every single day. Family medicine residency training makes it so that I'm in the ER, I'm delivering babies, I'm in the hospital, I'm in the clinics. And I kid you not, every single day insurance comes up. Just the other day, I was seeing a little boy who was having some respiratory difficulty from likely a viral infection. We needed to send him to the ER, and the parents were asking, well, which ER is going to be covered by my insurance? And I have no idea how to answer that question. That's just absolutely terrifying. And so, you know, my everyday work absolutely fuels my passion for this movement. And I think I'm in a unique position, you know, transitioning from residency and training to practice. and being connected to kind of the training in the university realm and wanting to pull kind of our younger folks into this movement permanently, so that we can really gain some momentum in what we're trying to do. We're really excited about what we have going on this year. I think Jen will get into kind of the nitty-gritty details later, but we are planning to host an in-person annual meeting this year, likely March, so stay tuned for that. And the momentum for our year is going to be capitalized, the cherry on top at the end of the year, with having our national Physicians for National Health Program annual conference in Minneapolis, which is a huge deal, as PNHP National, has thousands of physician and provider members. So really exciting stuff. I'm pumped. I hope you all are. We're all in this together.
Thank you, Christy. I think you broke some news there. I didn't know that meeting was coming up in Minneapolis. Wow. Okay. Next up, our Secretary Treasurer and longtime activist in this movement, Don Pilkinen, is going to talk a little bit about where, some of the funds that you may have donated with our year-end appeal for fundraising are going, how we spend the money you send us. Go ahead, Don.
There we go. Yeah, thanks, Ann, for the introduction, and hello, everybody, on this festive occasion going into the holidays. HCAM had yet another busy year with tablings at Pride Fest, Farm Fest, and 12 days at the State Fair, which came with the usual expenses. And 2024 looks like we're going to be even busier, as we should be if we're doing our job. And as usual, these activities continue to come with higher price tags of booth rental fees and liability insurance and banners and new signs and brochures and buttons. But the payoff of expanded education and outreach and more signups is certainly worth the bills that we have to pay to keep going and growing. Meanwhile, this continues to require work hours for our social media specialist, who's been noted, Jen Crawford. And also there's fees for the Every Action and Zoom for more meetings and webinars. And for our Director of Operations, Judy Bartons, who's doing excellent work and coordinating these activities with several committees, plus helping with planning and coordinating fundraising activities and volunteering to table when she can. She's a very busy woman. Judy again coordinated a successful Give to the Max Day, which helped to build our revenue going into 2024. For those who want to pitch in going forward, you can easily do so to make an online tax-deductible donation to our 501c3 HCAM Education Foundation. Just click the donation button on the upper right corner of our website's homepage that you see up on the screen that connects you to the contribution page. If you prefer donating by check, you can get a tax deduction by writing your check to the HCAM Education Foundation and sending it to HCAM. Especially helpful would be your consideration of a monthly sustaining donation, which would help in budgeting money we can count on and would boost the credibility of public support to show to prospective foundations in our grant applications. For the work that lies ahead in 2024, thank you to those who have chosen to make a donation of any size. Everything helps. And again, happy holidays.
Thanks, Don. Just time now for a few remarks from Judy Barton, our Director of Operations, kind of a year-end fundraising wrap-up, and maybe our activities for 2023, look ahead to 2024, which Don did preface a little bit.
Don actually did a great job kind of discussing our Give to the Max fundraising. That was our big effort this past 2023. Not only did we raise almost over $15,000, we actually nearly doubled the number of individuals who donated to us, which to me is a significant thing. We need to think about not just the amount, but also the amount of people who can give, because every little bit matters and helps. For end of year fundraising, I did put in the chat a link to donate. There is a button on that page that you can use to donate to us if you want to donate at the end of the year. Some people prefer to do all their donations at the end of the year. So if you want to do that, that is a good way for you to donate today. For next year, we're going to be doing some focusing on fundraising. We want to make sure that Healthcare for All Minnesota and PNHP Minnesota are sustainable organizations, and that we can and do reach more people. And part of that is funding. We do need funding in order to do our activities and effectively reach as many Minnesotans as we can. So please be on the lookout. We're going to try and think of some creative ideas and ways to make some funds or raise some funds this year. And if you would like to join join our development committee, we could use your help. We really need more people to help us with planning and events and planning some other exciting activities we're thinking about doing this year. Thank you.
Thanks, Judy. Now we're going to shift focus a little bit and talk about how we are organized to win reform. And the Minnesota Health Plan is our goal, but the steps along the way as well. So Roach, our Chair of Healthcare for All Minnesota, and Judy are going to detail the structure that we have come up with to make this reform possible.
Thanks, Ann. Can you put that slide up?
I can, yes. There you go.
So thank you so much. So everyone, I think that we have been talking about this for a few months now about how Healthcare for All Minnesota did a sort of leadership retreat last spring and just talked about how to really sort of restructure ourselves to in the model of distributive leadership and distributive organizing, and get more people involved and excited about the work. And obviously more hands make for lighter work overall. So you can see here a basic flow chart. The members are always at the top of a flow chart in a community organization or an issue organization or a labor organization. And then we have our board of directors, that there is an executive committee that is myself and Ann as vice chair and Don as the treasurer and Judy as our director of operations. And then you can see the volunteer level committees. So we have audience inclusivity, making sure that we are doing outreach and that we are making sure also that all of our materials are in various languages, and that we make sure to have interpreters when we have events and things of that nature. That's kind of a focus for audience inclusivity. Education to training is exactly what it says. We've got great educational programs, and we're just thinking about how to take it to the next level. You can see there that there is some of the work they'll be doing is online training, speakers bureaus, and material creation, as well as I believe they're going to think about doing some train the trainer, so we have more and more people that feel comfortable about going out and speaking about this issue. The communications committee is all about social media and, you know, whether or not we need to alert the media of anything that might be going on, as well as focusing on our marketing and branding and messaging. Fundraising development is you know what that is. I don't really have to explain that. So that's all about just continuing to make sure we have the money we need to do this work. Legislative and policy is very popular. They have a couple of subcommittees working under them, city council resolutions. There's a group of folks that are really committed to that and been doing incredible work in moving city council resolutions, and also organizational resolutions as well, because we do want to get more and more organizations to say that they support actually the Minnesota Health Plan and and Medicare for All. And then under organizing, we have two major committees. We have Coalition Builders that works specifically with the Health Justice Allies and bringing, as Ann said earlier, more and more organizations into this work. And Base Building is a little more of the individual organizing, being out there at that state fair and pride festivals and talking one-on-one with individuals and signing them up as members. So you can see what where the blue bubbles there show you a little bit of how the work relates to each of those two organizing committees. So I'm going to actually ask now, because these committees are now up and running. They have been doing incredible work since our last quarterly meeting, having a meeting and deciding on some really important information so that you all know whether or not you might want to join one of these committees, including when do they meet and what is their mission and purpose, and most importantly, what are the projects they're going to be working on over this next year. So I'm going to turn it over to Judy because she is going to go live and pull up our website to show you how you can access that flow chart, and then just hit a couple buttons if you're interested in learning more about the committees, and then another button to join the committee and help us do this work. Go ahead, Judy.
So Judy, I'd like to stop sharing so that you can come up. Okay.
Stop preparing for you.
Okay.
So this is the Healthcare for All Minnesota homepage. And in order to access this, it's really simple. All you need to do is click up here at Get Involved. And then here, if you're not subscribed, you can subscribe. If you need a speaker to come to an event, you can do that here. Donate, volunteer. Our calendar is here where you can check out upcoming events we will be at. But right here, join us is the committees. And if you hit on this button called committee, as it says committees, it will pull up the chart that Rose showed. It's a little small. You'll have to zoom in. That was as large, unfortunately, as I could get it on the website. And if you scroll down, right here, you can click this button that says join a committee here. So that's a form that you can fill out. But if you want to learn more about the committees, you can go here and say, okay, I want to learn more about education and training. You can click on overview and plan, and it'll pull up the plan for that committee. So you can kind of see what their plans are for that year and look at it and see if it's something that interests you. Then once you're interested, if you picked a committee you want to join and you click on this button right here, it'll pull up a page and there's just a few questions. Oops, I apparently jumped, sorry. Hit a button. So, and you scroll down, you just fill out your information there. Not everything is required. It'll tell you if it's optional, but then you can click on what you want. And then there's just a couple questions just to help us get to know you, and hit submit and you're done. And then someone should get back to you fairly soon. If it's a weekend, maybe give us a few days. So any questions regarding that?
Thanks, Judy. So this is a way that we can involve more and more people in the work. And you might notice too, Judy, if you could just show the bottom again where it where the committee bubble, or excuse me, squares are, you can see there under audience inclusivity, it says the meeting time is first Wednesday at 10 a.m. Organizing and base building is second Wednesdays at 7 p.m. Okay, so the dates and times that they will these committees will regularly meet are listed right there as well. So you'd have an idea of whether or not that would fit in your schedule, and then learn a little bit when you click the button on what they're thinking about doing. And if it sounds like something you'd be interested in, please join us. The more the merrier when it comes to doing this work. So I'm really very proud of all of the volunteers to date that have helped us put these committees together and have volunteered to start getting them up and running and serving on them. And of course, Judy and Jen for the incredible work they've done and promoting this and putting this all together. And we're ready to rock and roll. So pick a committee and come join us. Yes,
Okay,
Judy Schultz asked. Oh, excuse me, Judy Schultz just asked, are all meetings virtual? Yes, at this time we are continuing to do them virtual because it just seems easier for folks. We'd love maybe if every committee could just once a year have an in-person meeting. It might be nice just to connect with one another, but they are all virtual.
Yay, here's our chance to see each other and say hello. If anyone wants to turn their cameras on and say hello. Otherwise, I'm gonna go. Yay, hi Judy. I'm gonna go to our next agenda item. Dr. Ken Engelhardt is co-chair with Rose Roach of our coalition building work, which is a huge and important project for us, bringing on like-minded organizations. Ken is going to take over now and bring up his slides. Okay.
Can you see them, Anne? Are they okay?
Yes.
Okay.
You're not in presentation mode though. It's
Go to
just
slideshow. Yeah.
There we go. Okay. Hi, everybody, and happy holidays. As Anne mentioned, I'm Ken Engelhardt, and I'm just going to spend a few minutes talking about the Coalition Builders, the 2023 Coalition Builders Report. So you've probably heard these terms, and I think it would be helpful if I explain them a little bit to you, because you may wonder, well, what is a coalition builder? What is a health justice ally? So to understand what we do, I think it's good to know who the players are and what they do. I'll start out by our mission statement, our statement of purpose. And basically, it's the same thing as the Healthcare for All Minnesota mission statement. The Health Justice Allies Coalition is dedicated to promoting affordable, high-quality health care for every Minnesotan through advocacy, education, and community organizing. We believe the most effective means of achieving this healthcare goal is through a single-payer financing system as exemplified by the Minnesota Health Plan and improved Medicare for All. And so the coalition consists of a number of organizations that I'll show you in just a minute. We'll start out, though, with the Coalition Builders team. The Coalition Builders team is a group of activists from Healthcare for All Minnesota and Physicians for a National Health Program Minnesota. It's an organizing and planning team that's dedicated to achieving the mission stated above by collaborating with the Health Justice Allies Coalition. There's a member of a Coalition Builders team that serves as a liaison to every organization that's part of the Health Justice Allies and works with a representative of the Health Justice Allies organization for communication and collaboration. So, for example, I'll just use myself as an example. I am a liaison to COPAL, and everyone on the Coalition Builders team serves as a liaison to the representative of the Health Justice Allies organization. The Health Justice Ally is an organization that is a member of the Health Justice Allies Coalition that is also dedicated to fulfilling the mission stated above. The core of the campaign, Health Justice Allies are the core of the campaign to win guaranteed health care for all. Each Health Justice Ally has a designated representative that is authorized to speak on behalf of their organization, and that representative communicates and collaborates with the Coalition Builders liaison. The representative also participates in Health Justice Allies meetings and communicates Health Justice Allies, or it communicates health justice advocacy and education messages to their organization's membership. So here's a listing of the Health Justice Allies. I've listed everyone who has attended at least one Health Justice Ally meeting over the course of 2023. And as you can see, there are healthcare access organizations. One is Health Policy Advocates. We have Latinx organization. We have others. You can read through the list, and beneath each category is a listing. We have LGBTQ+ physician groups, progressive advocacy, rural health. Trouble seeing the next one. I think it's, let's see if I can move this. I guess I can't. There we go. We have senior advocacy, single payer financing advocates, small business, students, a number of unions, and veterans represented as health justice ally organizations. And to page down, double paging down, let me just, suddenly I kind of lost the ability to get the page down. Well, let me just go on from what I have on my cell phone here.
Ken, just try hitting enter.
Okay. Still not doing it.
If you hit escape at the top, that may bring it down and you can then select the page you want.
Okay. I hit enter and escape. Either one is working.
Go to the right, perhaps. Mouse to your right.
Strange.
There you
Okay,
go.
here we go. So this next slide shows the Health Justice Ally meeting dates that we had for this year. Roughly, we meet about every other month as a coalition. And I forgot to mention in the earlier slide, the Coalition Builders team meets the second and fourth Mondays of the month at 10 a.m. So what activities have the Health Justice Allies Coalition done this year? Well, we started out the year by signing a petition calling for the end of Medicare Advantage REACH program at protectmedicare.net. There were 17 Health Justice Allies organizations that co-signed a letter to Senator Tina Smith requesting a meeting to discuss concerns about the privatization of Medicare with Senator Smith. We were able to arrange an in-person meeting with Senator Smith's aide, Sarah Sangren. And at that meeting, it's an in-person meeting, we provided her with a great deal of information on Medicare overpayments to share with the senator. The Health Justice Allies Coalition was also involved in opposing the Fairview-Sanford merger earlier this year. During the legislative session, there was another assault rifle shooting in Nashville, and we asked the Health Justice Allies, as well as other advocates, to get involved in advocating for gun safety legislation, which passed this last legislative session, along with a number of other good features. The Health Justice Allies participated in the Medicare birthday celebration in July of this year. And more recently, the Allies have been involved in urging Minnesota U.S. senators to oppose the nomination of a guy named Kazukas. He sits on the board of Clover Health, which is involved in Medicare Advantage, making over $100,000 a year while sitting on that board. And at the same time, he's been nominated to be a public trustee on the board of trustees for Medicare and Social Security programs. And it's just really hard to think of another more blatant example of conflict of interest than someone who is on Clover Health, an insurance corporation involved in Medicare Advantage, while at the same time supposedly doing the citizens' work by serving on the board of trustees for Medicare and Social Security programs. So we've asked people to write to the U.S. senators and oppose that nomination. And then even more recently, we've been involved in reviewing what the legislature did this past session, and I'll go over that real quickly with you. This happens to be my last slide. There were 5 reports that came out of the legislature this past year. The first one is the public option one, and the report is due in just a couple of months, actually February 1st. And so we focused on that one the most, about different public option models. So that's one of the ones that we're involved in. And the reason I mention these 5 reports is that these are opportunities for advocacy in the future for the coalition, the Health Justice Allies Coalition, so that we can achieve just outcomes and genuine healthcare for all Minnesotans. Another report is administrative costs. That one is due March 1st, 2025. There's a second report on administrative costs. So the legislature is paying attention to the fact that healthcare in Minnesota is very costly, and there are high administrative costs to the point where they have authorized 2 reports dealing with administrative costs. You see that that second listed administrative cost mentions low value care. So I'll just interject a little personal opinion. I think they could start out by looking at low value care by eliminating zero value care, which is denials and pre-authorization. There's no need to question professionals who are experts in taking care of patients, many of which have had at least 10 years of training. So let's get rid of the low value, the zero value denials and pre-authorization. Another report is deprivatization. That's due January 15th, 2026. That one deals with getting the insurance companies out of our medical care. And finally, the one we've been waiting for a long time that's never been authorized before, and that's the cost study. What would it cost to have the Minnesota Health Plan in place? And that study is due January 15th, 2026. I've just touched on these just to mention these as opportunities to advocate for just outcomes for all Minnesotans. And I think the legislative committee will probably be going into this in more detail. So thank you for your time, and happy holidays, everybody.
Thanks, Ken. If you can stop sharing, I will then bring up. Oh, hello, everybody. One more chance to see who is in our meeting with us. So sorry, we have so much going on this evening with our agenda, but let me, I'm going to bring up our slides for our Legislative and Policy Committee. Don Pelkinen, co-chair of our Legislative and Policy Committee, Dave Garibaldi, co-chair, and then Rose Roach, who knows all everything that's going on with the Minnesota State Legislature on health policy. Go ahead, Don and Dave here. We will talk about the work of this very important committee.
Yeah. Thanks again, Ann, and thanks, Ken, for bringing up the slide on the elements of the new healthcare law, which I believe is historical. After 50 years of waste in healthcare spending caused by the HMOs. As I said, the enactment of the new healthcare law passed by the 2023 Minnesota legislature, the departments of Human Services and Commerce are mandated to finally study and report on the role that administrative costs play in driving up Minnesota's healthcare spending, which is now one of the highest in the United States. This mandate is due to the failure of HMOs, excuse me, the failure of HMOs and HMO contractors of Minnesota Medicaid and MNCare to reduce healthcare costs. Since HMOs took over running of Minnesota Medicaid from the Department of Human Services, which has been administering this program at a low overhead without profit for 40 years. The HMO contractors haven't saved money over this time in what was supposed to have been a pilot project created by the legislature 40 years ago. Therefore, the new healthcare law requires the Department of Human Services to determine how much money could be saved by directly paying the state's Medicaid and MNCare programs without the costly HMO administration, including profit. It also requires Commerce to study and report on the cost savings of a MNCare public option that is now administered by HMOs. These provisions in the new law provide the opportunity, as Ken mentioned, for removing the HMOs from these public programs to make them truly public. In other words, to deprivatize them. However, and I think Ken hit on this too, there's uncertainty that the studies to show the savings will be evidence-based and properly done. And if there will be a MNCare public option without HMOs. So Dave, take it over. And in our mission statement, Dave will mention how we're concerned about getting those studies evidence-based and accurately done, properly done, and to have a truly non-HMO MNCare public option.
Thank you, Don, and good evening, everyone. The mission of HCAM's Legislative Policy Committee is to work with state legislators and constituents on provisions in the law that allow for deprivatization. That's a word you're going to be hearing a lot from this committee. And what we're doing is trying to deprivatize the public health programs as steps toward enactment of the Minnesota Health Plan. Excuse me. We will do so by ensuring that the mandated reports from DHS and Commerce are done properly, and by advocating for a Minnesota Care public option, which is deprivatized. Meanwhile, we will work as much as we can at the federal level for Medicare for All and protecting traditional Medicare from privatization. Now, due to the immediacy of the Department of Commerce's Minnesota Care public option recommendation to the House Health, Finance, and Policy Committee by February 1st, our work plan's immediate goals are, number one, to persuade the Departments of Health and Human Services, that's DHS and Commerce, to analyze at least one deprivatized public option model and to recommend that version to legislators. And number two is to persuade relevant legislative health committees to endorse a deprivatized version regardless of what Commerce recommends by enabling constituents by information and trainings to effectively communicate the benefits of deprivatization with their legislators via letters and meetings. So that's where you folks come in. We really want to get as many folks as possible to get engaged in this process with the legislature. And it won't be a difficult thing for you to do. We'll come up with the letters and you folks send them to your legislators. We're hoping to get very active in this next session with doing this. Now, last week, we actually tested this process by sending evidence-based letters on the potential savings of a deprivatized Minnesota Medicaid and Minnesota Care to members of the House Health, Finance, and Policy Committee. It's a mouthful. This committee was scheduled to hold a hearing on managed care in our two state health programs, and that was scheduled for last Friday, so a week ago tomorrow. So the letters written by our policy expert, Kip Sullivan, suggested several important questions that we recommended that the committee members ask the managed care experts testifying before the committee. The letter was successful in that it elicited positive responses to our emails, and several of the committee members used the information we shared to make comments and ask questions that helped expose the failings of managed care HMOs in our public programs. So one third thing that we want to do and are planning to do this year is to do some electoral work that we will hold trainings for to elect pro Minnesota health plan candidates into the legislature in 2024 and to put pressure on those that have not joined the MHP caucus to do so. And that's pretty much our work that's coming up ahead of us in 2024. Thank you.
Thanks, Dave. Wondered, oops, one more, back up. Rose, could you comment a little bit specifically about that end of session omnibus bill related to the Minnesota Care Public Option?
Sure, I'd be happy to. So the omnibus bill directed the Department of Commerce, working collaboratively with the Department of Human Services, to provide a recommendation on how to do a public option. They actually didn't limit it to one, but they did say that there could be options of options for the legislature to consider. We have been really lucky because we are in the room, everybody. This is really important to stress. Healthcare for All Minnesota and PNHP are in the room. We are meeting with the Deputy Commissioner of Commerce, who is the lead person on overseeing this project, as well as a number of directors over at the Department of Human Services that oversee Minnesota Care, Medicaid, managed care, enrollees, all of that good stuff that goes on over at DHS. And basically, here's the down and dirty. Minnesota Care is a completely privatized public program right now. It's got a very tiny portion that may still be operating under a direct contracting fee for service, but basically it is a privatized program. What we were told, which could have knocked me over with a feather because I was not aware of this, but that for any of you who were around in this fight back when the Affordable Care Act was being debated and passed, you may remember we had Minnesota Care back in the 1990s, right? We've had it for a long time. Once the Affordable Care Act was passed, Minnesota Care needed to become what is called a basic health program under the law of the Affordable Care Act. Us, along with New York, are the only two states in the country that have a basic health plan. The idea is Medicaid is for people who are at 138% of federal poverty level or less, right? So that's very poor. And then in most states, they go straight on to an exchange if they can't get access to healthcare through any other type of program or through their employer. Well, those exchanges, as we all know, are pretty expensive. They're not really particularly terrific plans. And so here in Minnesota, we have Minnesota Care to at least catch people that are between 138 and 200% of federal poverty level. And so we had to apply for waivers to be able to keep Minnesota Care and to call the plan a healthy or make it a basic health plan under the Affordable Care Act. Well, guess what? Apparently, the Affordable Care Act says if you're going to have a basic health plan, it has to be administered through a managed care organization. So this is something that, you know, it's not unsurmountable for us to still deprivatize Minnesota Care, but it just throws another little ringer in there for us to think about whether that is done through, you know, the waiver process or whether there might be some other creative ways for us to think about what that means in deprivatization. But the way the bill is written, 2995 there up on the screen, Commerce has interpreted that to say the first thing that they have to do is take the current program, which is privatized, and simply do a MinCare expansion. So, you know, go beyond the 200% of federal poverty level, take it out to 400% of federal poverty level, which is the maximum on the exchange, the MinSure exchange, and then start to play with it. Is it going to keep all of the good stuff that they currently have in the Minnesota Care program, which is its high actuarial value, which just means insurance pays a lot and the person pays a little when it comes to out-of-pocket costs, a wide expanded network. What are the reimbursement rates for the providers that are going to be part of that network? And what are the premium costs? And will the state subsidize some of that premium cost to make it affordable for people to purchase as an option? That is basically what they're going to present to the legislature. So it is not going to be a public option. It's going to be a privatized public option. We're still in the room talking with them. We've been pushing them to try to do an actual deprivatize because we want to see what that looks like, because we think it could save money, right? And we could use some of that money for actual health care for people. And they said, yep, they get it, but they don't have the time and the resources to be able to go beyond the one directive they received, which is to first model an expanded Minnesota Care program as it currently exists. So all is not lost with that. I mean, this will provide some interesting information for us. But at the same time, and I'll talk about this in a minute with the Minnesota Health Plan caucus leaders, there's kind of a feeling like a private public option is kind of an oxymoron and isn't sort of where we want to go. So this probably isn't exactly what they were hoping for or looking for in the long run. We shall see. But I think it is important for us to think through eventually whether or not a truly, completely deprivatized direct payment contracting Minnesota Care program could in fact be a stepping stone to building infrastructure on our pathway to the Minnesota Health Plan, because we have something unique here in Minnesota with this program. Any other state that has tried a public option, they started them out as privatized public options, and they are all struggling. We have an opportunity to possibly do this and do it right. I'm not 100% convinced yet. There's a lot of things to think about to make sure it's successful, and that is key. We have to make sure any public option is successful. But at the very least, we're in the room. We're helping to throw all of those ideas and all of those obstacles that we think exist to try to figure out and brainstorm how we can get past them to see whether or not expanding it over and over and over, so more and more and more people, not just those on the exchange, but small businesses and farmers and even employees that have healthcare through their employer. If it's not good healthcare and this is a better plan, is there a way for them to be able to be participating in the true public option? So we've got to think about all of those pieces. And I think the biggest message is we're in the room as they're discussing it. Right now, the Health Committee in the House is not necessarily planning a committee hearing on this particular report, but things could change. They've got a pretty full agenda already going into the session. It's a short session. It just kind of depends on what happens with the report, whether a bill or something comes out of it. The Senate, we're not sure. The Senate may very well do a hearing on the report itself. If that happens, we're going to want to try to get a hold of y'all and let's pack that room and hear what's going on there, and maybe even potentially offer some testimony about how we're feeling about a privatized public option. It just sounds so silly to even say that. So I see that there's a hand up.
Thank you so much. For sharing our thinking. As you can see, we're thinking about this and, trying to come up with ways to influence this process. I'd like to recognize Teresa Keaveney, who is so we didn't put in an official Q&A time because the agenda is so full, but Teresa is the state chair of the DFL Rural Caucus. Teresa, do you want to go ahead?
Yeah, Teresa, hi.
Hi, thank you. My question is related to Dave's presentation. Will this group develop resolutions that can be circulated at precinct caucuses? Maybe you said that, or maybe it's on the agenda later, but I just want to encourage that. I know various caucuses within the DFL are generating resolutions, and I know within the Rural Caucus, healthcare reform and healthcare justice is a priority. And then I would also just say, I don't know if very many people who are new to Medicare, I'm one of them, know how privatization is siphoning off public funds, and it may be worth a discussion about how we do some outreach and education on that. As a consumer, should we be signing up for Medicare Advantage plans?
Teresa,
Too late
thanks.
now.
Yeah.
Sign up's over, but
Dave, can I take a shot at that piece first, and then I'll turn it over to you? So I'm going to talk specifically about Medicare Advantage in a couple of minutes, but I'll tell you what, Teresa, let's connect. I have done a presentation for the DFL Senior Caucus and for a chapter or whatever of the Senior Caucus in Minneapolis, specifically on Medicare Advantage. I'm at a national table that is strategizing Medicare Advantage, and I mean, it's crazy. And you are right. We should not be signing up for Medicare Advantage, although I understand why people do it. It's all about finances. I'm not looking to shame anyone, but I do think people have to understand how really seriously at risk our Medicare fund is. Probably 5 years from being completely taken over from Wall Street, everybody. We're not going to have a Medicare for all. We're going to have a Medicare Advantage for all. We can't let that happen. And we have got to start to really, really sound the alarm bells, you know, feel the urgency around getting both Congress, the White House, and CMS. There are 3 buckets of work for us. And please stay, again, I don't have immediate asks of you tonight. Well, we do have a little bit of an ask for you tonight, but I'm going to have a more detailed ask once we get into the first of the year, because we're putting together a national strategy on how to start to deal with the behemoth that is robbing us of our Medicare fund, which is Medicare Advantage. And all of us, whether we're retired now or not, should care about this deeply. So thanks for raising that. But maybe I could do that presentation at a future Rural Caucus meeting. Invite me up, and you know, and we'll talk a little Medicare Advantage. I've found people are really responding to that presentation, and I'm very appreciative of that information, Teresa. So if that's something you'd be interested in, let me know.
So reclaiming Medicare as a truly publicly administered public program for seniors and the disabled is one of our top priorities. We'd like to be talking just about fixing how we pay for healthcare, but we realize we have to preserve and protect and defend Medicare. So to the beautiful segue into what Rose is going to talk about next.
And Anne, I do want to circle back, and just in case Dave wants to say anything about the resolutions, but I will tell you, Teresa, I've been working with my other hat as the national coordinator for the Labor Campaign for Single Payer. We are working a strategy to get state labor feds to pass what is called a level the playing field resolution that basically says Medicare Advantage is ripping us off. We should take that money and we should make traditional Medicare better. I mean, literally, they are stealing so much money from us that we wouldn't even have to pay a Part B premium if we could capture that money and put it into traditional Medicare and make traditional Medicare a real option for people to consider, right? So I'm working on adapting that resolution as something we could take to DFL precinct caucuses next, February, right? Towards the end of February, because I think we got to get this on the radar screen of our state party. So thanks for asking that question. And Dave may have ideas about this beyond just Medicare Advantage, but some of the Minnesota Health Plan and deprivatization stuff for the state.
Yes, Teresa, there is a plan going on, as I said, on the electoral type plan to push candidates to be for the MHP, and also we're going to try and get a standardized resolution that we're going to disperse widely. And I will be in touch with you because we have talked before, and I'm hoping that you may want to participate and get some of your members participating in this electoral plan that we have, that we're going to be having a few trainings for. And it'll be using the caucus and convention process to do what I just said, basically promote this resolution and really raise the profile of the MHP in the electoral process. So I will be in touch with you. And anybody else who wants to get in on this electoral process, you know, send your information to Judy and she'll get it to me. Thank you.
All right, so Ann, I'll go
Okay.
ahead and just dive in
right.
to the the Medicare Disadvantage stuff. As I said a couple of times here, that I'm honored to be serving at a national Medicare Advantage strategy table that includes numerous national organizations who are all working together to save Medicare from this complete Wall Street takeover that is on the horizon. That takeover, corporate Medicare, known as Medicare Advantage, which is neither Medicare nor is it an advantage, is extremely dangerous. And we likely have, as I said, about 5 years at most before private equity, hedge fund managers, and Wall Street are going to own our Medicare program. Before we can achieve Medicare for all, we need to save, protect, improve, and expand the traditional Medicare program. We want Medicare for all, not Medicare Advantage for all, which is nothing more than the for-profit healthcare, not for patient healthcare. So Congress, however, is, you can see here the little graphic on the side, is really hearing two different stories. Providers are meeting with Congress and telling them that Medicare Advantage is actually hurting their patients. Well, America's health insurance plans, also known as AHIP, is telling them that, oh, hey, we're doing a great job. We're decreasing inequities, you know, and more people of color in particular are signing up for these plans, and therefore they're getting better access to health care. That's not true. I mean, it's not true that they're necessarily getting better access to healthcare, because when you have Medicare Advantage plans, you have all kinds of parameters put on you. You've got potential for higher out-of-pocket costs. You have got networks you have to deal with that you don't in traditional Medicare. And you also, probably most importantly, have to, many times, once you actually have to use the product, you are going to get stalled with prior authorizations and huge numbers of denials of claims. You may have seen a lot of headlines lately about a number of hospitals, including the American Hospital Association, who has gone absolutely crazy, basically saying, we're not going to take Medicare Advantage patients anymore because you all are refusing to pay us when we treat patients based on the treatment as it is prescribed by a physician or a provider. It's bad, 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 and it is really harming rural communities. I mean, think about it. If Mayo stops taking Medicare Advantage plans, what is Southeast Minnesota going to do? Any of you all living in that area, you know that they're pretty much the only game in town. So this is really a critical issue. And by the way, their facility in Florida has already made that claim. They are not taking any Medicare Advantage patients anymore in their facility down in Florida. So this is nonsense. But because it's lower premiums on the front end, and because of systemic racism across the board in this country, people of color many times, particularly in retirement, have less money. And so this looks like the best deal for them to be able to purchase a Medicare Advantage plan, but it doesn't translate into seeing actual inequities decrease, since these Medicare Advantage plans on the back end are denying significant claims while forcing doctors and nurses to go through tedious prior authorization processes before any treatment can be provided. Congress simply must restore Medicare to its full vitality, cutting off the private corporations, leeching off the healthcare program that we, the people, created, funded, and rely upon to fatten their own wallets. Reviving Medicare to its original health is the only thing that can revive our health. If you have a Medicare Advantage treatment denial story, please contact me and I will put you in touch with two national organizations, People's Action and Be a Hero. Both are working to tell the story of seniors who are struggling with Medicare Advantage. People's Action will even help you appeal the denial if you need that kind of help. I want to just let you know that hot off the press just this afternoon, the Biden administration has released an announcement that they are putting new efforts to stopping anti-competitive mergers and anti-competitive practices by dominant corporations and health healthcare markets. They're launching a cross-government public inquiry into corporate greed in healthcare. The Department of Justice, the Federal Trade Commission, and HHS will issue a joint request for information to seek input about how private equity and other corporations increasing power and control of our healthcare is affecting Americans. The agencies will use this joint request for information to identify areas for future regulation and enforcement prioritization, and they will continue to work together on case referrals, reciprocal training programs, data sharing, and further development of additional healthcare competition policy initiatives. They're also increasing Medicare Advantage transparency. They want to take steps to improve Medicare Advantage data transparency. And today, CMS has announced a new phase of this work, which will start with soliciting information from the public early next year to strengthen CMS's data capabilities and Medicare Advantage transparency efforts. And finally, they're going to be cracking down on anti-competitive and anti-consumer practices in Medicare Advantage. The Medicare Advantage is increasingly dominated by just a few large national plans. Last month, HHS announced new steps to stop predatory marketing and steering of patients to Medicare Advantage plans that may not best meet the needs of those patients. HHS through CMS has proposed a rule that would, if finalized as proposed, stop large insurance plans from offering brokers and agents lavish compensation. They get 3 times as much money for pushing you into a Medicare Advantage plan than putting you into traditional Medicare with a gap plan. They get cash bonuses, volume bonuses, and many other types of perks, and working with marketing middlemen who are more likely to contract with large insurers, leading to steerage of patients to the plans based on the compensation to the broker rather than based on the needs of the patient. So these are marketing ploys. They are not about healthcare. We've got to stop them. So these are good steps. They're not everything we need, but this is good to know that these types of things are being put forward. We are going to have their back. We are going to have to be strong on this and stay connected. More to come once we have the plan together, and we're going to start working on this in January. So everybody beware, because there is lots for us to do. Next
Thanks,
slide,
Rose.
Ann.
It
And I
sounds
think
like they're feeling the pressure, and
they
I
are.
say we need to apply a whole lot more pressure.
Yeah,
That was a lot of words that we are going to need definitely more definitive action to push. But thanks.
absolutely.
Thanks, Rose.
But I just want to say that
Yeah.
it is because of the pressure and the fact that we are
Yeah.
training and talking to people about
Yeah.
this, and it's getting traction, everyone. Congress is starting to pay attention. The White House is paying attention, and CMS is paying attention. So this is very good news, but you're right. Lots more to do, and we have to
hard
get
job. Yep.
Yep.
Okay, now some good news, I think. An update from Rose on the Minnesota Health Plan Legislative Caucus.
Yes. So I'll be brief on this. There are new leaders. The Minnesota Health Plan Caucus leadership is now Senator Dr. Elise Mann, Senator Liz Bolden, a registered nurse from the Rochester area, Senator Andy Smith, also from the Rochester area, and Representative Samantha Sensor-Mura, who is from the Minneapolis area. They are absolutely raring to go. A couple of things that I just wanted to highlight in here is that they are working on regular caucus meeting schedules, as well as defining what they think should be prioritized for 2024 legislatively. They are also working to define their overall vision and strategies. They are very open to including educational work and topics that we think are important for legislators to be aware of, and to work with us on providing some of those types of educational forums. So that's really, really good. They absolutely want to continue to work with us outside of the Capitol, and they are planning to attend our health justice meetings. They would attend a quarterly meeting if we wanted them to. And they are also interested after session in putting together some district listening sessions, some health equity listening sessions, where we can start to go out to the community and ask them, how is healthcare working or not working for you? And what kind of a healthcare system do you think we should have, and where should the focus be? they are also going to be very intricately involved in the Minnesota Health Plan cost study, and working directly with MDH on that, the Department of Health, and they are meeting with Commerce and DHS about the public option and some of these other reports that are going to be due, and particularly they are very interested in the deprivatization. So they have once again invited us into the room to help them strategize some of this work, and I'm honored to be representing you in that room. And the first meeting will be a week from tomorrow, actually, to start that conversation. So good stuff.
Awesome. Thanks a lot, Rose. Next up, we're going to hear from Jen Crawford, who is Executive Director of Physicians for a National Health Program, Minnesota. And if you don't mind, I might just take down my slides, Jen, so that we can see each other while you talk, if that's okay with you.
That is great. Thank you, everybody, for hanging with us. I will keep my comments brief. First and foremost, I just wanted to say 2023 was a big year for us at PNHP, and we couldn't do anything that we do without you. So to anyone who volunteered their time or made any size financial gift, thank you from the bottom of our hearts for every contribution that you made, time, energy, thoughts, all of the things. So we really appreciate it. We are completely funded by individual donors, and we have a lot of work to do next year. And so if you haven't made a contribution this year, I'm just going to put this in your mind just before I start talking. If you'd be willing and able, we would welcome you to visit our site, take a look around, and maybe make a donation before the end of the year. 2023 was a big year for PNHP National. As you know, we are the Minnesota chapter. We are the boots on the ground here in Minnesota. Every year, our biggest project is our summer internship program. It's a 7-week, basically a boot camp for several medical students in their second year. We were graced with amazing energy and passion this summer in our med students, and we're so excited to see the work that they've already started doing since we finished up in August. They are leading the Students for a National Health Program chapter at the U of M Twin Cities campus, and we're excited to keep you updated on all of the great things that they're doing. They are inspired by our national organization, who had kind of a silent year. It was a year of research and strategy and organizing, using an inside-outside strategy, working inside the national legislature, and also kind of outside of it as needed with partnering organizations and making smart decisions. And a very groundbreaking report was shared in October, and that was led by the National PNHP organization. It was called I'm sorry, I want to get this right. It is called Our Payments, Their Profits. And I'm going to share the link to it right now. If you haven't seen this or read it or read about it in the New York Times, it is a groundbreaking report, and there's going to be a lot of action in 2024 to come out of this report. And so we have high hopes for all of the things that are going to happen, and it's all going to culminate here in Minnesota for the 2024 PNHP National Meeting. And so we hope that you will stick with us in the next year. We will be doing our annual meeting in person as well. We would like to organize and energize our organizations. We are going to be trying to meet with medical societies across the state and getting healthcare workers excited and energized to promote single-payer healthcare reform, because 2024 is going to be a big year, as we all know. And so thank you so much. I really appreciate all of your time tonight, and we look forward to seeing you all next year. Thank you.
Thanks, Jen. Amazing. So I'm Ann Jones, again, retired registered nurse, vice chair of Healthcare for All Minnesota, and I'm also chairing the organizing and base building committee. Rose mentioned we have two branches of that base building effort, bringing in like-minded organizations and then bringing in individuals. So we're the group who does a lot of stuff, like going to events and tabling. And I want to recognize we did the many volunteers who created and staffed events around the state this past year. We held either educational events or staff base building events in Duluth, Maple Grove, Piers, Red Lake Falls, the state capitol, Woodbury, Northfield, Stillwater, Minneapolis, Mankato, Edina, Redwood Falls, maybe more. I may have missed some. If I did, let me know. We participated in Juneteenth events, Pride festivals, Farm Fest, local farmers markets, all 12 days of the Great Minnesota Get Together. We even held a 58th birthday party for Medicare, thanks to Dave and Lana, who are on this call, pretty much, and Gina, at Southdale Library, with a lot of great participation and a lot of electeds who showed up. Thanks so much to our volunteers, and thanks to you, we added 845 people to our Healthcare for All Minnesota database. That's just the people who agreed to be on our mailing list. We talked to hundreds of people, more than that. So we've touched, and connected with many more people. There may be more who also joined the Physicians for a National Health Program Minnesota database. I just have the numbers for Healthcare for All Minnesota. So again, thanks to all those volunteers. We will be doing some of the same events and busier than ever next year. I already got the notice from the Pride Festival, Twin Cities Pride, to get going and sign up. It never ends until we fix this mess, right? So please join. It actually is kind of fun to get out there and talk to people about this issue. So consider joining, even if you don't formally join our committee, at least volunteer to help staff these events.
And
so,
we have a question. So between your things, can we?
Sorry?
We have a question.
Oh, okay.
Sarah, do you want to ask your question?
Yeah, I do. Sorry, for some reason my picture isn't showing up. My question, I guess, more towards what Rose was talking about Medicare Advantage, and what I see in the hospital setting that I work at. But that's something I could pass on to Rose. One of the things is these big mega corporations like United, Cigna, Aetna, Humana, is that they're vertically integrating all of healthcare, not just direct medical care, but many aspects of it, from owning providers and pharmacies and PBMs and stuff like that. So I also have wondered too, is that people should be considering that of divesting from these companies if they have any investments in them. I mean, that maybe sounds kind of obtuse or something, but a lot of people are really happy with their 401ks, and the fact that United Health is like 5 to 10% of the whole Wall Street market right now, that that there are people that are going to fight that end. And I just see it as a source of like, well, if these companies fail, then our 401ks go down the toilet. So I'm putting it out there, but I see the horror stories after horror stories of my elderly patients in the hospital who have fill in the blank Medicare Advantage plans and can't get in, can't get post-acute care. And it's absolutely financially devastating, as well as the amount that patients do not know the difference between Medicare Advantage and Medicare. They just don't get it. But anyway, that's my 2 cents. And I hope that maybe we can also look at it from that aspect too of, I'm glad my 401k is doing okay, but am I invested in these companies that are doing these nefarious things?
Yeah, I think it's a really important point, Sarah. And I know a number of years ago, there is a physician leader with the national PNHP, Dr. Rob Stone, and he was leading up an effort on divestment, quite frankly, and just trying to figure out how to sort of get some traction with that, and never got it to the degree that we really need it to have the ultimate impact. But it's absolutely something that should be continue to be considered as yet one more tactic, right, that we should be thinking about taking inside of this movement as a whole. I want to note that, you know, you said it, you know, United Health Group in particular, they are practically the single payer system for this country at this point. Because as you said, they're buying up PBMs, pharmacies, physician clinics, et cetera, et cetera. I mean, it's a very dangerous thing.
And they're also well integrated into CMS.
Yes. Yeah, yeah, you're right. Yeah, I know. They go back and forth, right? Depending on the administration, they work for United Health, they go into CMS, they leave CMS, they go back to work for United Health. Yeah, there needs to be something.
Yeah, they're actually they're running the CMS's their Opticare is running the entire CMS logistics program.
Yes. Right. Yeah, I mean it's and I won't get into details on this, but some of you know the buzzword of 340B drug program. And we find out that this is it started out as an altruistic idea to get drug companies to give big discounts to a few hospitals and particularly clinics that take care of very impoverished neighborhoods, right, of patients. But of course, it's become completely sort of bastardized. And we found out that it is a department inside of CMS that is 100% privatized by a company that is run by a conglomerate of hospital systems, big hospital systems. So they're dictating at this level so that they get what they need down here at this level. I mean, it's a mess. They have absolutely infiltrated everything. We've got a lot to unwind here, but I think continuing to just bring this stuff public, and we're doing a good job with that. I mean, the New York Times, they're all across the nation are these big articles about what's going on within Medicare Advantage. So I think we're on the right path here, but you are right. There's a lot of work to do in regards to figuring all of this out.
Yeah,
thanks, Sarah. We actually need to
that's fine. Okay.
Because we're very close to our.
I'm sorry. I thought we were at the very end. Okay.
Thanks so much, Sarah. We are doing our best to educate, but
and Sarah, reach out. Feel free to email me. I'll put my email, and we can connect about this like after the first of the year if there are stories or whatever. So let me get you my contact information.
All right. So last few agenda items. One of our big efforts going forward is to bring more people to the fight and create more activists. These are some of the activities that our education and training and our base building committees are working on. As we educate, organize, and build our base of support, work with legislators, we need to bring more people in. We're just really needing to build the political will, not only to influence the changes we've talked about tonight, but to get the reform we want. We just ask that you all review this list. And when you get the slides, you can take a better, a look at it at your leisure, see where your skills, talents, interests, and activism fit in, and where you can contribute to the single payer movement. For events coming up, there is something coming up on Saturday that I want you to be aware of. The One Payer States, which is a group that kind of pulls together all the states in the U.S. that are working on single payer state-based plans, similar to our Minnesota Health Plan, is doing a series of events that are trying to bring together all of the social justice movements that have like interests or similar interests and get some synergy. This Saturday, December 9th at 11 a.m. is a panel and discussion on the intersection of military veterans and social justice movements. The featured speaker is Suzanne Gordon, a journalist and an expert on the VA health system. You can go to onepayerstates.org. I think there's a period missing there. Anyway, onepayerstates.org to register for that. It's just a couple hours, very good information. The Minnesota State Legislative Session starts February 12th, just putting a couple things on your radar. The precinct caucuses are February 27th. You'll be hearing from us on resolutions to bring to those caucuses for your precinct or your party organizing unit in Greater Minnesota. Look for information from Legislative and Policy Committee. And as always, let us know of local events we should promote. I see in the chat that the Wright County Indivisible group has put their event coming up the 11th, Monday the 11th. Ken Engelhardt and I are going up to Monticello to talk about Medicare Advantage. By the way, I mean, protecting and defending Medicare. And that is at the VFW in Monticello. Go ahead, look in the chat and you'll find the time and the directions for that event. And then continue to write and call and respond to action alerts. So that event in Monticello is open to the public. We need your help to spread our message. I'll make a pitch for people to join our social media sites, engage with our social media sites, mostly Facebook and Instagram, and also take a look at YouTube for all of our educational events and meetings that we've held in the past. You check under videos for recorded events. And then we also have some social media training for you to use if you are needing that. Here's some great websites for more information and for great stuff from our allies locally and nationally. I've got the website for PNHP Minnesota, ours, the information for getting Senator Marty's, the Minnesota Health Plan, and Senator Marty's book on common sense universal health system. Let's see. Healthcare for All Minnesota, Fix It, the Fix It videos, which are great basic training on this issue. Also allied organizations nationally, One Pair States, Healthcare Now, Labor Campaign, Public Citizen, Social Security Works. Really pay attention to Social Security Works, what they are taking a lead, and along with Public Citizen in pushing back against this privatizing our social safety net programs. Healthcare Uncovered by Wendell Potter. Every week, some horrible information about corporatized healthcare, and then Health Justice Monitor. So those are other great, useful websites. And then, what would an activist and advocacy meeting be without a call to action? You've already heard about the report that PNHP National did called Our Payments, Their Profits. Jen mentioned that. She's put the link for this in the chats. Easy read. This is all about what Advantage plans, which are not Medicare, are costing our Medicare trust fund. So this is great basic information and good talking points. Advantage plans are draining the Medicare trust fund to the tune of somewhere between 88 to 140 billion dollars a year. This is not pocket change. So you can tell that we're very concerned about preserving Medicare as a publicly funded and publicly administered health program for seniors and the disabled. So what can you do to help? Well, call the White House. There's a comment line open on Tuesday, Wednesday, and Thursday, and use the talking points on this slide to tell the president that you want the fraudulent overpayments because of Medicare Advantage plans stopped. These insurance company profiteers are bankrupting Medicare through fraud and abuse, and we want improved and expanded Medicare. We could afford, as Rose explained, we could afford to provide all the benefits these Advantage plans advertise that they offer, just with the money that is currently being spent on Medicare that is going into the pockets of these for-profit insurance companies and their shareholders. Also call their U.S. senators and your own member of Congress. And the number is on the screen there. So be sure you give your name, phone number, zip code, and state that you're a constituent. The second ask that I would make is we have learned that there are two appointees to the Social Security and Medicare trust. There are two nominees to be public trustees for the Social Security and Medicare trust funds. One is submitted by the Republicans and one is submitted by the Democrats. the president officially makes the nomination, but the one submitted by the Republicans through Minority Leader Mitch McConnell is named Demetrius Kazukos. He was a senior executive at United Healthcare, held 2 positions. So he's had both public and private positions in the Health and Human Services and health care arena. He's currently on the board of Clover Health, as Ken explained, a for-profit insurance company with significant income from Advantage plans and hundreds of thousands in compensation since 2021 as a board member and stockholder. So it would be obvious to anybody that he has a significant conflict of interest in being appointed as a public trustee for our Social Security and Medicare trust funds. He will not commit to stepping down, even in light of these obvious conflicts of interest. And please note that overpayments to these Advantage plans directly benefit his personal financial status. You can use these talking points, go back to the phone numbers on the previous slide, call the president and call your US senators and call your member of Congress and ask that this nomination be either withdrawn or voted down by the Senate. So thank you for that. Obvious example of regulatory capture, somebody who goes back and forth between the industry and public agency positions. With that, I'd like to wish you all a happy holidays, however you celebrate, and please take time to enjoy holidays with friends, family, co-workers. We appreciate everything you contribute. We appreciate your energy. You give us energy on our, as boards of Healthcare for All Minnesota and Physicians for a National Health Program to continue this work. We will see you in the new year. And Jen and Judy, we can get a wrap up for you. And would our presenters please stay on for just a couple minutes for a debrief? Thank you so much.
Everyone again for sharing or for joining us tonight. There will be a follow-up email sent to everyone who registered that will include the recording of this meeting as well as the materials presented. So you will get those. It will probably be early next week before those get sent out. So please be on the lookout for that. And if you have any questions, always feel free to contact us. Thanks, everyone.